Hi everyone, welcome to Med Lectures with Dr. Gayatri. Today we are going to focus on Ulna Bone. So first we will see about side determination. So this is the upper end, lower end and shaft. Upper end has this notch which faces anteriorly known as trochlear notch. This is olecranon process and coronoid process. So it faces anteriorly. Then lower end has this styloid process which faces posterior-medially. And this is the sharpest border, lateral border, which is also known as interosseous border, which faces laterally. So this is the left side ulna. So this is the left sided ulna bone. Let's now discuss it in detail. Let's study the features of ulna in detail. It has upper end, shaft, lower end. Upper end has two processes. This is olecranon process and this is coronoid process. In between them there is a notch called trochlear notch. On lateral side it has one more notch called radial notch. Olecranon process has mainly 5 surfaces. Upper or superior surface, this is the superior surface. Anterior surface, posterior surface, this is medial surface, and lateral surface of olecranon process. Then the upper or superior surface has insertion to tricep brachii. Medial surface has origin of flexor carpi ulnaris muscle. Now coronoid process has 4 surfaces: superior surface, anterior surface, medial surface and lateral surface. Anterior surface has tuberosity called as ulnar tuberosity and it has insertion of brachialis muscle. Then the medial surface has origin of flexor digitorum profundus muscle and the lateral surface has this radial notch which has origin to supinator muscle at supinator crest. Let's discuss about the shaft. The shaft has mainly 3 borders. This is the sharpest border, lateral border, also called as interosseous border. Then this is the anterior border of ulna and this is the posterior border of ulna. Let's study surfaces. 3 surfaces are there. Between the lateral and posterior border it has posterior surface. Between lateral and anterior border it has anterior surface, and between posterior and this is the posterior border and anterior border, in between them there is medial surface. Let's study muscle attachment of ulna. Anterior surface has origin of flexor digitorum profundus on upper 3/4 part and on lower 1/3 there is origin of pronator quadratus. So upper has flexor digitorum profundus and lower has pronator quadratus. Now medial surface. On upper 2/3 there is origin of flexor digitorum profundus. On posterior surface there is insertion of anconeus above the oblique line, and below oblique there is the posterior border which has origin of mainly 3 muscles: abductor pollicis longus, extensor pollicis longus and extensor indicis. Now let's study with this is the olecranon process and olecranon fossa. While forming elbow joint with the full extension of elbow, this is the full extension of elbow joint. The medial lateral epicondyle of humerus and tip of olecranon process, it makes straight line. this is a straight line between three of them, but during the full flexion, that is like this, during full flexion of elbow, it forms the isosceles triangle. Isosceles triangle like this, it is not in the straight line. So during fracture, this is disturbed, or dislocation of olecranon process, this triangle gets disturbed. Then with radius, ulna attaches like this, articulate like this at the radial notch, forming the radio-ulnar joint. This is the radio-ulnar joint. Now with humerus, it forms the elbow joint, and ulna articulate with the humerus form humero-ulnar joint. Now let's study the clinical anatomy of ulna. This is the X-ray where the shaft of the ulna is fractured either alone or along with that of the radius, and the cross union between the radius and ulna must be prevented to preserve pronation and supination of the hand. The fractured shaft of ulna without any other fracture is called as nightstick fracture. It occurs due to direct hit on shaft of ulna, may occur when watchman raises his arm against trauma. This X-ray shows the fracture of upper one-third of ulna with dislocation of the head of radius. It is known as Monteggia fracture. This X-ray shows the fracture of olecranon with anterior dislocation of head of radius. It is known as Hume fracture. This deformity is known as Madelung deformity. It is a dorsal subluxation and displacement of the lower end of the ulna. It is due to the retarded growth of the lower end of radius. I hope you understood today's lecture. Thanks for watching. Keep learning, keep growing, keep exploring. Thank you.